It's important for me to try to really match the reconstruction with the patient. And what I'll do is I'll talk to my patients, I'll go over the various different options, try to find out what's important to my patients. I'm a plastic and reconstructive surgeon here at Fox Chase. My area of expertise is in microsurgery and cancer reconstruction, and as part of my practice, I treat patients with head and neck cancers, breast cancers, skin cancers, as well as extremity cancers such as sarcomas. Reconstruction really provides not only the aesthetics, but also the functional recovery for the patient. When I first see patients with breast cancer, obviously they've been recently dealt a big blow, they've been diagnosed with cancer, and oftentimes their concern is not so much the cosmetics of it. And what I tell patients is that you may not be concerned about it now, but in a year, you're going to be concerned about how it looks. So when a patient presents to Fox Chase, they'll see our breast surgeon. The breast surgeon will then refer them to myself or to one of my colleagues for a discussion of reconstructive options. For head and neck reconstruction, perhaps the largest contribution we've made in the last several years is the use of three-dimensional surgical planning, where we can essentially perform the operation before the patient even sets foot in the operating room. What we found is that we've actually reduced the time of the operation. We've improved the outcomes in terms of their ability to heal. A special interest of mine is managing patients with lymphedema. This is a relatively new field. We like to consider ourselves pioneers in this. Once lymphedema sets in, patients have a lot of symptoms. They have pain. They're at increased risk for developing infections in that extremity. So at Fox Chase, we're doing two operations now to help patients that have lymphedema. One is called the lymphovenous bypass, and the other is called the vascularized lymph node transfer. The volume of their extremity, the size of their extremity is reduced, which is really the goal here. The most gratifying thing to me is once I've taken a patient through the journey of cancer and reconstruction, it's a very gratifying and rewarding thing for me to kind of see them back to their normal life, their normal activities. I just think that that's a very fulfilling part of my job, and that's really what motivates me, I think.